personal history of invasive breast cancer. In the sense that if a lady has got breast cancer in the one breast, right breast, let us take, she has high risk of getting same breast cancer in the left side. So personal history of invasive breast cancer, or the presence of pre-cancerous lesions like ductal carcinoma in situ, lobular carcinoma in situ. These are not the frank malignant lesions which we see in breast, but these are the pre-cancerous. So having these pre-cancerous lesions again poses them at having high risk or getting high risk for the breast cancer causation. And benign breast disease. So here also we would like to emphasize on one point: all breast lumps are not cancerous; they are non-cancerous. Most of the times, when young females come to us in OPD with phobia and anxiety, so they are all afraid because of the wide, information available on the Google net. So everyone thinks, but the problem is most of the times all the lumps are not non-cancerous. So there is something called as benign breast disease, as we all know. So benign breast disease, which may be fibroadenoma, fibrocystic adenoma, all that with atypical hyperplasia. So even in evaluation of these benign breast disease, we just subject them for the breast true-cut breast biopsy. So in that, if we see that they have the atypical hyperplasia component, again they are the candidates for high risk for getting the breast cancer. So benign breast disease with the presence of atypical hyperplasia. And the other important reason or risk factor is radiation for other diseases, like in the treatment of other diseases like Hodgkin's disease or breast cancer itself in the opposite breast. So ionizing radiation exposure can cause the breast cancer. And most importantly is hereditary point of view. If you think, so BRCA1 and BRCA2 genetic mutations carriers. So this is one of the important, because so as we all know about Angelina Jolie effects in the breast cancer, because her mother has this BRCA1 and BRCA2 genetic mutations. So obviously she has inherited these mutations, and she underwent both mastectomies as well as hysterectomy. So this is all possible because of the latest advancements or latest developments in finding out what are the risk factors and what we can actually empirically do to prevent the further risk of getting the breast cancer or uterine cancer. So after that, really the rates of mastectomies in US have gone sky high. So and even the screenings with BRCA1, BRCA2 genetic mutation detections also have gone sky high. Then later people understand the positive points and negative points of this testing as well. Then now it is being conducted in the moderate amounts, if not so high. So these are the high risk factors for the causation of the breast cancer. And in a similar way, we have the moderate risk factors, like for any cancer, increasing age itself is a risk factor. So in a similar way, age above 40 years is a moderate risk factor for breast cancer. And of course, reproductive factors, very, very important. Early menarche, less than 12 years, late menopause, more than 55, and nulliparity, having no kids, is also a moderate risk factor. And in the similar way, dense breast, benign breast disease without atypia. So at low risk factors are alcoholism, obesity, reproductive factors, of course, out of which important nowadays is hormone replacement therapy, OC pills usage, as well as having the first kid after 30 years of age. So these are all the risk factors which most of the patients would Google up and come, but still they have their doubts, their own. Their doubt predominantly is, why me alone? That's the problem. So the problem is the physician, treating physician or examining physician also, most of the times, let me put it in 80 to 90% of the cases, we cannot pinpoint a single cause for that particular patient, why this particular patient has got breast cancer. So this is a multiple causations, as we rightly already discussed, lifestyle related, hereditary related, and many other factors which we still don't know. That's the catch. Yeah. So once a patient is diagnosed with breast cancer, so obviously we'll be subjecting them to multiple array of tests, like in the form of Rupert biopsy.